Welcome to the Vitality Prescription. I'm Dr. Yaz. I'm triple board certified endocrinologist and obesity specialist, and today we're tackling an important and often painful topic, diabetic neuropathy, particularly in the feet. This condition affects many individuals with diabetes, leading to discomfort and decreased quality of life. So we'll discuss the best treatment options available, including natural solutions, medications, and strategies like addressing the root causes of inflammation and poor circulation. The reason I want to do this podcast today, honestly, is so many of my patients suffer from neuropathy. And often they come to me after the sugar's already so elevated and the pain is so bad. But usually how neuropathy starts is just really minor. So the first segment, I want to really get into just understanding diabetic neuropathy so you know what to look for. So first of all, did you know that neuropathy affects about 50% of people with diabetes? So if I talk to two people in a room, one of the two who has diabetes likely has neuropathy. So let's explore what it is and how it develops and why it matters. Diabetic neuropathy is a type of nerve damage caused by prolonged high blood sugar levels, which can lead to a range of symptoms, particularly in the feet. It often develops over years and can significantly impact your daily life. Key symptoms include numbness and tingling, and many individuals experience a loss of sensation in their feet, making it difficult to feel cuts, blisters, or other injuries, which is why it can lead to amputations. So an amputation, right, if you've ever seen a diabetic who's missing a toe or a limb, is not the first symptom. No, it started with the numbness and tingling, or maybe loss of balance. So if you're someone who's been feeling a little off balance or numbness and tingling and you have diabetes, this is where it's starting. After that, then sometimes it progresses to sharp pain, burning pain in the affected areas, and then weakness, muscle weakness, which can lead to difficulties with balance, walking. You may have increased sensitivity to touch, which causes discomfort wearing certain shoes, or even when the feet are resting on the surface. Now, the reason I mention this is because if you can recognize this, you can do early intervention. And again, the importance of early intervention is that you can prevent complications like those foot ulcers and infections, which lead to hospitalizations and other health issues, including the amputations. In a nice study in diabetes care, they highlighted that diabetic neuropathy is a significant contributor to foot ulcers, amputations, and they emphasized the need for effective treatment and management strategies. Now, the next thing I want to jump into is natural solutions. So the first thing is easy, and it's cheap. Lifestyle changes. What if I told you that some simple lifestyle changes and natural remedies could alleviate your diabetic neuropathy symptoms? So let's discuss this. First thing is, I want you to do some dietary changes and incorporate some anti-inflammatory diet foods. Think about incorporating foods rich in omega-3 fatty acids like salmon, walnuts, flax seeds, antioxidants like fruits and vegetables and whole grains. These can help reduce inflammation and support nerve health. The next thing you can do is blood sugar control. You want to maintain stable blood sugar levels through a low glycemic diet that can prevent further nerve damage. Consider meals that are balanced in protein, healthy fats, and complex carbohydrates, rather than refined carbohydrates. There's supplements on the market that have been studied for this, and one is alpha-lipoic acid. This antioxidant has been shown to reduce symptoms of diabetic neuropathy. In a study published in Diabetes Care, they found that it can help alleviate neuropathic pain. Another essential vitamin is vitamin B12. This is essential for nerve health. See, vitamin B12 supplementation can help improve these symptoms, especially in those with deficiencies. And as we discussed in one of our older episodes, if you remember, metformin can cause B12 deficiency. So if you're someone who has diabetes, there's a high chance you're on metformin. And if you haven't checked your B12 levels, definitely check them because this can help those symptoms. Plus, you may already be deficient in it because of the medication you're on. In a nice review published in the Journal of Clinical Endocrinology and Metabolism, they emphasize the importance of this when it comes to neuropathy. Now, if you Google this, online, you'll see there's a lot of companies doing this. One I can think of off the top of my head is Nerve Reviver. They have, these different supplements that kind of combine these vitamins like alpha-lipoic acid, B12, and other nutrients aimed at reducing nerve pain and promoting nerve health. And clinical studies have shown that the ingredients in this can help improve symptoms of neuropathy. Now, these studies may be smaller studies, and, everyone's different. I know from my patients, alpha-lipoic acid is not fixing everyone. B12 is not fixing everyone at all. But one source by Ziegler et al., they looked at alpha-lipoic acid in the treatment of peripheral neuropathy in diabetes care. The next thing you can do, besides decreasing inflammation with your diet, lowering the sugar, is physical activity, Regular exercise improves circulation, reduces blood sugar levels, and enhances nerve health. See, activities like walking, swimming, cycling can definitely be beneficial. You may also want to try things like mind-body practices like yoga and tai chi. These practices improve circulation, flexibility, and reduce stress, which also can help manage neuropathy symptoms. In a study published in the Journal of Alternative and Complementary Medicine, they found that participants experienced improvement of nerve function after practicing yoga. So as you can see, we're already seeing a lot of different things that can help neuropathy. And if I was suffering from it, to prevent the complications, I would do each and every one. Now, the next thing I'm going to mention is medications, And while natural solutions are helpful and don't have side effects, sometimes medications are necessary to deal with this. See, you can use things like over-counter pain relievers like NSAIDs or acetaminophen that can help alleviate the pain. However, these are obviously Band-Aid solutions. They put a Band-Aid on the pain. They're not actually fixing the cause. Other things like antidepressant medications like amitriptyline or duloxetine have been shown to be effective in treating neuropathy. In a review in neurology, they actually support the use of these medications for symptom relief. Another medication that we see all the time in the office is gabapentin and sometimes pregabalin, which can help reduce nerve pain and are often prescribed for diabetic neuropathy. Studies show that these medications significantly improve pain and function in patients. Other options are topical treatments like capsaicin, a cream that can provide relief from localized pain by reducing substance P, a neurotransmitter that transmits pain signals. The next thing I want to discuss is the root causes. Did you know that addressing the root cause of diabetic neuropathy can significantly improve your symptoms? Let's dive into just how to do that. So first things first, foot care. Regularly check your feet, okay? Look for injuries, infections. Keep your feet clean and moisturized to prevent these complications. Think of things like compression therapy, like wearing compression socks, which can help improve circulation in the legs and feet, potentially alleviating symptoms. Another thing is reducing inflammation, right? And managing stress. As chronic stress can cause inflammation, incorporating relaxation techniques like meditation, yoga, and deep breathing can help manage stress levels. The next thing is hydration. Staying well hydrated helps maintain circulation and can reduce inflammation. The next thing is you may want to modify your lifestyle if you're doing things that can hurt you, like smoking. See, smoking absolutely impairs circulation and exacerbates neuropathy. Quitting smoking is crucial for improving overall health and reducing symptoms. Also, I want you to regularly visit your healthcare provider and podiatrist going for foot exams and diabetes management, which can help prevent the complications associated with neuropathy. The next thing is I want you to address your blood sugar levels very tightly. You want tight control because that's critical in preventing and managing neuropathy. You want to regularly go over your diabetes management plan so you can mitigate this damage. The next thing is physical therapy. See, let's discuss some innovative physical therapies that can provide relief for diabetic neuropathy, including vibrational therapy, conductive therapy, Epsom salts, and advanced devices like the Nerve Reviver unit. See, a vibrational therapy, right? This therapy uses mechanical vibrations to stimulate nerves and improve circulation in the feet. Research has shown that vibration therapy can enhance nerve function and reduce pain in individuals with diabetic neuropathy. By stimulating the sensory receptors in the feet, vibration therapy may help improve blood flow and reduce discomfort. A study published in Diabetes Care found that individuals using vibration therapy experienced reduced neuropathic pain and improved balance. Another one is conductive therapy using Epsom salts. This approach combines soothing properties of Epsom salts with electrical stimulation. By soaking feet in warm water with Epsom salts while using the conductive device, magnesium can help reduce inflammation and provide pain relief. Epsom salts contain magnesium, which can enhance nerve function and improve symptoms. And studies suggest that soaking in Epsom salt baths may help alleviate muscle cramps and discomfort associated with neuropathy. Another therapy to discuss is cold laser therapy, or low-level laser therapy. This non-invasive treatment uses light energy to stimulate healing and reduce pain. Cold laser therapy can enhance circulation and promote nerve regeneration. Research indicates that it can be effective in reducing neuropathic pain and improving nerve function in diabetic patients. I also researched another thing I've been seeing a few of my patients using, which is the Nerve Reviver unit. This is designed to provide a comprehensive neuropathic approach, which combines modalities like electrical stimulation and biofeedback to help improve nerve function. Now, of course, all these companies are going to have small research studies supporting the use. Like Nerve Reviver unit, they have their own studies demonstrating electrical stimulation and enhanced nerve repair and improved symptoms. That being said, you have to try it yourself. Every person's different. But if you understand that the nerve is supplied by blood and your cells, and you understand that sugar causes inflammation and affects the nerve and the cells and the blood flow and circulation, you need to fix the circulation, right? All the things mentioned so far do that. So whether it helps relieve your pain or not is a different story. But we know just by mechanism, it could be beneficial. So just to conclude, because I know I gave you guys a lot, we discussed the best treatments for neuropathy in the feet, covering ranges of symptoms like natural solutions, medications, and addressing root causes such as circulation and inflammation. And so my key takeaway for you is to focus on an anti-inflammatory diet, consider supplements, maintain regular physical activity, and when needed, use medications like pain relievers, topical treatments, antidepressants, and discuss this with your healthcare provider. I want you to look at these root causes, looking really to improve that circulation, reducing that inflammation, and making lifestyle enhancements to enhance your quality of life. And consider using products to help you do this, like Nerve Reviver, cold laser therapy, and therapies like vibration and conductive therapy with Epsom salts, which all have their own benefits. Of all the treatments discussed, the most evidence-based approach that truly moves the needle in managing diabetic neuropathy are the medications, unfortunately, and supplements like alpha-lipoic acid and physical therapies. So these methods have shown substantial effectiveness in different studies in reducing pain and improving your function. All right, that's all I got for you for this one. Thanks for joining me on the Vitality Prescription. And if you found this episode helpful, please subscribe, leave a review, or share it with others who might benefit. And for more information or links to sources, check out the episode notes. Until next time, take charge of your health, and remember that managing diabetic neuropathy is achievable with the right strategies.